doing the best we can. And
Well, you figure it out.
yeah. So, oh, we're live. I see that. So I guess we'll start. Hey, everybody. My name is JD Scholten. I'm running for Congress right here in Iowa's 4th Congressional District. Just wanted to let folks know tonight that we are going to be talking about the coronavirus. I am honored to have 2 guests here. Before we introduce them, we're each are going to talk for a little bit, and then we're going to open it up for questions. So if you have questions, put them in the comments below. We'll get them asked, and this is mostly meant to be an informative discussion. I just want to say my heart goes out to all the folks who have gotten sick already. We had our first death here in Iowa, and this is going to be some tough times. And so I'm also very appreciative of all the people at the front lines, where the nurses, the doctors, the grocery store clerks are so important, the pharmacists. And so just very appreciative of all those folks. I know there's a lot of effort. We're going to try and produce a lot more of local stuff here in the future. I know we have in Sioux City here in Woodbury County, we'll have our first drive-through testing facility starting tomorrow. We're going to try and promote stuff like that all along this way as we're all in this together. So with that, I would love to introduce our 2 guests. We have former Senator Heidi Heitkamp from North Dakota. Thank you for getting on board with us here today. And then we have Dr. Eli Perencevich. I've been practicing all day and I screwed up this moment. Perencevich. Is that right?
No, Perencevich, yeah, no problem.
Perencevich. Okay. So I guess we'll start with you, Doctor. Do you want to introduce yourself and talk a little bit before we open up for questions?
So yeah, honored to be here, JD and Senator Heitkamp. I'm Eli Perencevich. I'm an infectious disease physician and epidemiologist at the University of Iowa, Carver College of Medicine out here in Iowa City. Been kind of involved in infection control, hospital epidemiology for the past 20, 25 years. So kind of seen some of these outbreaks. So I guess, JD, you asked me to talk maybe for 5 minutes or so, just kind of give a background on what this virus is and what's going on, and explain a few things, and then happy to answer questions at the end of this. So the first thing, there's a lot of words flown around: coronavirus, COVID-19, SARS-CoV-2. The main disease we're seeing now is called COVID-19. That's coronavirus disease from 2019. That's the condition caused by the virus called SARS-CoV-2. And SARS-CoV-2 is a coronavirus related to several other significant viruses, called SARS, which is severe acute respiratory syndrome, which appeared about 2003 and quickly disappeared, and then Middle East respiratory syndrome, which is another coronavirus still in existence, mostly in the Middle East, but has also affected a lot of people in Korea a few years ago. There are 4 other coronaviruses caused the common cold and have been circulating for many years, but this is kind of the first new one that's kind of spread widely. And it was first detected in late December. Actually, there's a really cool email listserv, kind of old-fashioned, called ProMed, and all of us got an email on December 30th that there was some strange respiratory virus circulating in China. To be aware, some unknown pneumonia was spreading. And quickly it became apparent there's a widespread outbreak in Wuhan, China, which is a city of about 6 million people in the heartland of China, very similar to the way we think of Chicago, kind of a hardworking town in China. And the best guess is that this virus hopped in a seafood market from a bat virus through another a mammal called a pangolin, which is kind of a cute, my son, who's 13, it's his favorite animal. And it kind of hopped there and somehow got into humans and started spreading. And now, I mean, as you know, it's kind of all over the world. It spread initially throughout China, almost 80,000 cases there, throughout Asia, Singapore, Hong Kong, South Korea, and now huge outbreaks in Italy. We're all seeing terrible issues in, I think, the Lombardy part of Italy, Spain, Iran, and of course, the United States. Really recently, the past 3 or 4 weeks have been really hard. We have over 70,000 cases and 1,000 deaths related to COVID-19. And then I just, specifically to Iowa, we had our first case, and I'll remember I was sitting with my son having a sandwich at a local Panera, got a text message on March 8th that we had our first cases here in Iowa in Johnson County, which is where Iowa City is. And there was, I guess, a link to a Nile River cruise that a local bank sponsored, and a lot of folks came back positive from that Nile River cruise. And now in Iowa, we have 179 cases. Unfortunately, as you mentioned, and definitely heart goes out to the family of the person that died in the Dubuque area. So our first death a couple of days ago. And just today, we've had 34 more cases kind of spread throughout the counties. Probably a third of the counties, I didn't count today, are affected. Unfortunately, testing is not yet widespread. I'm sure we'll talk about that a little bit more with questions, but we haven't really, ramped up testing widely where you can kind of just drive up like in some other parts of the world and get tested, although that's happening very quickly, and probably why we're seeing more cases here in Iowa. But what we guess is that we're missing maybe 3/4 of the cases because we're not testing everyone. So we have more than 179 cases here clearly in Iowa. We don't know how many, but it could be, many hundreds more that we're not testing. So what is COVID-19 disease? Most of you probably have heard this. It's a viral respiratory pneumonia. It usually is associated with fever, but can progress to a severe pneumonia and respiratory failure. In up to 5% of patients, they can end up, unfortunately, on a respirator, which is, a breathing machine that saves most of the lives. About less than 1% or maybe 1% of people end up dying of the disease. And that's largely in those folks are older or have comorbid conditions. That doesn't make me feel any better because I parents alive that are older with comorbid conditions. So that's kind of what the disease is. It's spread by respiratory droplets. And what that means is when you cough or sneeze, these kind of big droplets, and they're not huge, but big compared to the virus, spread about 6 feet from you. And so that's why we have this whole 6 feet rule, stay 6 feet away from people. And then the other way, and we're seeing more and more of this actually, is through contact. So kind of direct contact, shaking hands, or potentially through indirect through the environment. If I grab a doorknob and someone else touches it as well, it can spread. We know that the virus can last maybe a day on things like paper and kind of cardboard boxes, and up to 3 days on things like plastic or steel. So that's kind of a risk too, while we're all washing our hands. What are the symptoms? And I kind of touched on this a little bit of the coronavirus. Do you think you have it? And unfortunately, they're non-specific. It's really hard to tell if you have a flu or another infection because the number one symptom is fever. Almost 90% of people have fever. And then things like dry cough. You're not bringing up anything, you're just kind of hacking. Fatigueness, aches, shortness of breath is the concerning one. And that's what should prompt you to call your doctor and quickly get evaluated. And one thing we're learning about over the past week, I've seen this a lot more, is that there's a loss of smell and a loss of taste. And that's pretty unique. So I think if you can't smell or taste, and I've seen other reports from other countries, loss of appetite, and I wonder if that's what it was, because you wouldn't want to eat too much if you didn't smell or taste anything. And that's something to keep your eye out for. And then there is some more reporting of nausea and diarrhea, but that's still in a small percent and usually in the most severely affected people. The other thing that about the virus is that the incubation period, so the time from when someone unfortunately maybe coughs on you till you develop symptoms, is about 5 days, but that can be out to 14 days. And so that's why there's this quarantine we're doing for some folks for 14 days. And then why do we care about coronavirus, and why is it different than the flu? You'll hear a lot of people say, oh, it's just the flu. It's clearly not the flu. We're not shutting down our country every year for influenza. It's about twice as transmissible as influenza. and the mortality is probably 10 times as high as influenza. And one thing I read yesterday, really nice piece in the New York Times, which modeled it. There's a old colleague of mine, David Fissman, who put this model together with some colleagues. They said that if one person had influenza, and then you look 2 months later, they would have infected 386 people, and maybe a few ended up in the hospital. With COVID-19, if one person has it and we look two months later and nothing's done, we kind of ignore it, 100,000 people will have been infected and 20,000 will end up in the hospital. And so that's why we need to do social distancing.
Amazing. Well, that's amazing. The doctor has just done an excellent job, kind of, I think, already responding to so many of your questions about what is this disease? Why is this different than what we've confronted in the past? How did it originate? Why does it spread so quickly? Just to kind of tell you a story about how we're handling it in North Dakota. I travel quite a bit. I do work for ABC and CNBC, and I'm teaching a class on the East Coast. And so I'm on airplanes a lot. And so when I got home, my husband, who's a family physician, who cares about keeping his patients safe, told me I would have to reside in the basement and he would reside in the upper levels of the house because I really should go in quarantine for 14 days, which I totally agreed with, because I think some of the emotional stress that's happening to people is the fear that not that they will get it, but that they will give it to someone else. Mm-hmm. And especially someone that they love, who's elderly, who then wouldn't be able to manage the disease as well. And so, ironically, he went off to work and ended up diagnosing the first case of community spread. And so we couldn't decide which one of us was at a higher risk of contaminating the other one or giving the disease to the other one. So this is everywhere. That's my point. The woman that he diagnosed was, an 8 to 5 employee, very little contact. In fact, no contact with anyone who had traveled that she knew about. And so I think it's really important that all the kind of diminishment of this disease and of what's happening with the coronavirus, we all need to take a deep breath and listen to the people who actually have MDs and PhDs and the people who are public health experts. So I'm not here to tell you what to do with how to manage your space and your quarantine, but I am here to tell you that in conjunction with the challenges that you're now seeing in the public health community, we are engaged in a serious economic crisis. Crisis that the Congress just responded to with a $2 trillion stimulus bill. And we can all argue about whether the balance is right in that bill. But I think at this point, it was critically important to stabilize the economy and to make sure that we are dealing with the high rates of unemployment that we know are coming, that we provide some relief to small businesses, that we provide a safety net to families, and that we actually get more money moving into the economy to replace the dollars that would otherwise be coming in. It's interesting because there's a lot of people who talk about libertarian values or conservative values. I always say there's no such thing as a conservative or a libertarian in a pandemic. Right? We all want the government to respond to what's been going on. So let me tell you about 3 areas that I'm concerned about. The first one is that the Congress has addressed. The first one's the Paycheck Protection Act. And you might say, well, why not put everybody on unemployment? Just let the companies lay them off. We have an unemployment system. Why would we backstop small businesses who are trying to manage through this by paying their mortgage, paying their insurance, paying the salaries of their employees? because we want those small businesses to survive in America. They are the backbone of our economy, and we want to be able, once we know that we get the all clear from the public health community, we want these folks to have jobs to go back to, or keep their job and keep their health insurance at the same time. And so the Paycheck Protection Act is going to be what they originally called kind of a loan program for small businesses, which then will be forgiven if you spend the money as a small business in a restricted way. You can't go out and buy a new building. You can't go out and invest it in a plane ticket to wherever it is that you want to go. It's got to be invested, and it's got to be used for salaries. It's got to be used for employee benefits. It's got to be used for your mortgage. It's got to be used for your rent and for mandatory expenses that a small business would incur. That's a huge amount of this stimulus. But not every small business is going to be able to hang on to their employees. And that's why many of my colleagues, my former colleagues in the United States Senate, insisted on a amping up of the unemployment system. Now, there's two reasons why you should be careful if you're looking at, a paycheck protection versus unemployment. Unemployment will not take care of your health insurance. And so you've got to be really careful as you and your employer are making decisions on what you're going to do. The unemployment, as you know, if you've ever been on it, and my dad was a seasonal construction worker, so we're well familiar with the limitations, does not replace 100% traditionally, does not replace 100% of your salary. What the Congress did is they basically said, we want to keep people 100% whole. And so that was the big debate last night about the $600, because there will be some people who actually get more money than what would be their weekly paycheck. I think it was foolish for some congressional members, some senators, to assume that means automatically people want to be laid off. I don't think anyone wants to be laid off in this crisis. And so you've got two provisions that are very important for working men and women and for families in this country. One is keep small business afloat so that they can continue to keep you on the payroll. And if it's not possible, to make sure that to the extent possible, we are in fact helping with unemployment. I don't know, JD, maybe you can tell me, is Iowa a state that has expanded Medicaid?
Yes, but they privatized it as well. And so,
well, I mean, there may be more coming from your state in terms of open enrollment. This is an event that would allow you for open enrollment in the healthcare system known as the Affordable Care Act, otherwise known as Obamacare. Lots of discussion about whether we could expand the benefits there. The third provision for individuals is really a direct payment to Americans who earn, as individuals, earn $75,000 or less, or who as a couple earn $150,000. Now, the first thing I would tell you, get out your tax return, because there's three different levels of income on that tax return. The first would be your gross income, which is traditionally on line 1, your taxable income, which is what the tax rates apply to, but your adjusted gross income. Your adjusted gross income on the new tax form for 19 is on line 8B. And if on that line you've married with filing jointly, you have less than $150,000, you should be receiving $24,000. They are not expecting you to apply for that money. What they are expecting is that the IRS will, in fact, has access to all of this data, will be sending out checks, or will be doing direct deposits if you're an e-filer. If you are a single person, you have $75,000 on that line or less on that line, then you will in fact get the full amount of the $1,200. There is a phase out on both sides of that, but pretty much if you're earning $100,000, or if your adjusted gross income is $100,000 or $200,000 if you're a joint filer, that any amount of payment is phased out. And so the thing that I want to get through before we get to questions is, if you are a senior watching this and you say, I haven't filed tax returns for years, I don't have a filing obligation. I don't earn enough money. And so how am I going to get this money? What I would say is we have to get you filing a tax return, even if it's a zero-sum tax return. If you are a student and you haven't filed a tax return because you don't have a filing obligation, we have to get you to file a tax return for 19. And so I'm looking at ways in North Dakota that I can assist our seniors and our students and our young people or disabled people who also don't file tax returns to actually get those returns in so they're not left behind. And so these are all kind of things that are going to happen. The final thing I want to talk about is the needs of nonprofits at this point in time. You know, if you're running a domestic violence shelter, you can't shut down and send people home. If you're running a homeless shelter, people don't have a place to stay at home too. If you are dealing with runaway kids, and so Congress did amp up appropriations for these folks, but at this time, if you have any extra dollars to give to your domestic violence programs, if you have any extra resources that you can provide to homeless shelters, if you can look at food security, and there's a number of provisions, but it's going to take a while for those provisions to get worked through. Think of those people and those organizations in your community who deal with the less fortunate. And please, if you can be generous, please be generous. There is a provision, or at least there was in the original bill, I haven't been able to check on this one, that would give you an above the line deduction. So if you give a $300 contribution, you will in fact get a deduction even if you don't itemize in 2020. So there's a lot of this to work through and a lot of details, but I wanted to just cover what I think are the three most significant provisions for individuals and especially for working men and women, and to get you to look at line 8B, which is your adjusted gross income, which is going to determine your eligibility for the grants that Congress has approved or will approve once the House adopts them.
Well, fantastic. Both very informative so far. And we have our first question. And just to remind folks, put a question in the comments below and we'll try and get to them. Our first question is from Michelle, and she asks, do you think we will build immunity after we get through this crazy time? And do you think this will become our new norm? So for the doctor, will we build immunity towards this?
I think every indication is that we're all people who are getting infected are forming antibodies. And so we expect people to become immune to this virus. What we don't know is if it'll become more like influenza every year and kind of mutate a little bit and we can become infected. You know, we get common colds every year as well. So it's going to be somewhere like that, but we expect once we get through this, it won't be this high level of mortality and morbidity.
Can I just make a comment? You know, I think there's always this sense that, oh, we got through this, therefore everybody can relax. I hope what we take out of this is we need real responses. This was a predictable pandemic. A lot of people in the doctor's situation would tell you they've been studying for years what a respiratory virus would, you know, a virus that attacks your respiratory system and travels so quickly would do. And so we all need to think about what happens with the next iteration. And it may not be this virus, but it may be something else that is equally lethal.
That's great. The next question, I think both people can answer. It's from Latifa. And what would you suggest to do to help ensure our rural communities and our already shrinking county hospitals have the resources they needed to cope? So let's start with Heidi, and then we'll move to the doctor too.
Well, we've been working very closely. You know, one of the things that you have done is expand Medicaid, which has been so significant to keeping our rural hospitals going. I think that the most significant thing that we can do is figure out how we're going to deploy resources to keep hospitals cash flowing. What's happening right now in the healthcare industry is that they aren't doing elective surgeries, a lot of hospitals. They aren't doing the things that produce the revenue, and that's creating a cash flow shortage. And so I would say the first thing, when you're looking at supplies and equipment, the first thing that we need to do is we need to keep hospitals solvent. There is a lot of money in the stimulus bill or in the recovery bill that the Congress just passed to help with hospitals. I think the other thing is we continue to look to the federal government. Where are the respirators? Where are the masks? Where's the personal protection equipment? And at some point, they have to get this together and realize that we need an Amazon kind of distribution system so we can rapidly deploy those kinds of that equipment to help solve these problems if you're in a rural hospital and you only have one ventilator or two ventilators. That may be inadequate in a breakout. And so I'm hoping that the federal government and encourage your senators to encourage the administration to do a better job in identifying and deploying those resources.
And I 100% agree with what the senator said as far as supporting all the hospitals that have just had their revenue disappear, much like all of us have seen our jobs disappear with this. All elective clinic appointments and surgeries are canceled. The other thing we can do to save our rural hospitals, there are two things. One, we need to social distance like crazy, like we really mean it. I feel like in Iowa City we are, but I don't know about, I can only kind of see what's around me. And so we got to stay home to save lives. If we don't spread it, then this virus will not impact our communities as our worst fears. And the second thing we need to do is ramp up testing again like crazy. We need to have drive-through testing almost everywhere in all the 99 counties in Iowa. We need to have it available readily. And then we can see where the hot spots are, and we can plan not only where to get resources to, as the senator said, in an Amazon way, but then we need to think about how we can move the patients to where the ventilators are. So we have a lot of ventilators in the bigger cities. And if we plan ahead and manage this well, we'll be able to shift the patients. And that's what the Netherlands is doing. They're really moving the patients out of the hotspot areas to the other areas where there are open ventilators. So it's going to be a moving of people and supplies. But the most important thing is stay at home, follow the social distancing that our governors put out very seriously. And then we won't have to get to that point, hopefully. Hopefully we can keep the disease burden underneath the kind of thresholds that we're seeing as far as number of ventilators and hospital beds.
And this is a great follow-up question from Kim. How will we get more testing in Doctor, do you want to?
Hey, JD, we couldn't hear you.
Oh, yeah. Oh, I'm sorry. Rural broadband, that's the other issue. The question from Kim is, how will we get more testing and why is it so limited?
So yeah, there are several reasons. One, we kind of slept for a couple months while the rest of the world was preparing and while we knew this was coming. There were issues with the CDC testing, and then there were regulatory issues at the FDA that prevented our local academic hospitals and other groups, even private industry, from ramping up testing. Those have kind of moved away, but now we're having issues with supply of reagents, supply of swabs, supply of test kits. And so it's a multiple factors. And again, we need an Amazon type response where we can get these out to the states. And hopefully this will happen over the next few weeks, but it can't happen soon enough.
Can I just point out that a lot of the supply chain in testing is global. And I think in this country, if we're really serious about doing something, we need to have the capacity to manufacture antibiotics, manufacture this right here at home. And I'm not somebody who ever talks against globalization, but when it affects our national security and our health security, we need to take a real hard look at making sure that we have the capacity to automatically produce ventilators and that we're not begging people to transition their factories right now. We just would automatically know where we could go to get medical equipment that's necessary in a pandemic.
Yeah, and it reminds me of former Governor Vilsack and Secretary of Agriculture Vilsack always says we're a secure nation because we're a food secure nation. And there, I think we need to expand on that as well. That's one thing we often talk about in our campaign on creating more regional food hubs to help create an infrastructure to have more markets for our agriculture sector as well. Next question is from Kimberly. What are the provisions in the Senate relief bill that help small businesses? Many mom and pop shops don't want low interest loans.
Yeah, and I think, Kimberly, that's exactly right. And, you know, I wrote a op-ed saying, do not tell people who are already have huge leverage and are just, you know, living, you know, paying the bills and just getting by to tomorrow, that they're going to take on more debt. And that's why the Paycheck Protection provision here is a loan. It will go through a lot of the same process, but it is going to be forgiven as long as you spend that money to keep the business open, by keeping employees on the payroll, making sure that you're paying rent with it, or making sure you're paying your mortgage interest. And so so the Paycheck Protection provision of this is significant. There's also emergency loans, so there is a loan provision with this as well. SBA has a huge job to do in trying to figure out how they're going to balance, because many of our small businesses already have guaranteed SBA loans, and there can be some I think real opportunity to lever some of the work that they've already done to make sure businesses stay open. So what I would say is that they did it right for small business, especially if you're, let's take a restaurant. We know that your capital costs are minimal compared to your payroll, your inventory for food, the kinds of things that keep your door open. So to me, we'll see. The proof is in the pudding. If you have a state government, we have a bank in North Dakota that we own. I've been really encouraging the Bank of North Dakota to step up and bridge some of the loans for small businesses until the federal government gets their programs up and running. And so there may be an opportunity to convince your banker to help bridge this, recognizing when this comes, it will in fact be backdated to I think February 20th. So, you can't say if I apply, that's going to be the start date. The start date can be February 20th if you're a business that's been impacted by the coronavirus epidemic.
And to follow up on that, we're going to have some links for folks in the comments section. So SBA.gov will be the federal one. Here in the state of Iowa, it's iowabusinessrecovery.com. Small businesses can apply for a $25,000 in-state grant to stay afloat during the coronavirus pandemic. Businesses can apply for a grant or tax assistance starting Tuesday morning at iowabusinessrecovery.com. The application deadline is Tuesday, March 31st at noon. So we'll put that in links for that in our comments for folks who want to know more about that.
Good for Iowa, JD.
Yeah.
Good for Iowa.
So next question is from Kim. Is a shelter in place in Iowa or across the country the best next step? So a shelter in place. So Doctor, do you want to?
Yeah, so there's that's kind of the next step of social distancing, kind of extreme social distancing. I think.
And do you want to describe what that is also?
Yeah, what social distancing is, or shelter?
Or both.
So social distancing is the general kind of recommendation that we kind of stay at home unless we have to do activities, keep 6 feet apart. It's more like physical distancing, stay away from people. It's other things like closing schools, closing universities, teleworking. All of these things are various components of social distancing, or I like to call it physical distancing, because we can still be social over our phones and iPads and things. And then the shelter in place is where you're forced to stay home for all but going out and getting food or going to critical work, and that at various levels of enforcement. I will say that in other countries that have this widespread disease, it has had to come to that to get it under control in Hong Kong and places like China and certainly Italy. And so we may be heading that way, like New York City in many places. But it's not a one-size-fits-all approach. That's why we need to test everyone as much as possible so we can make rational decisions about when to ratchet up and ratchet down.
Yep. Okay. And then from Lori, thoughts on homemade masks. I get something is better than nothing, but as an RN, this seems like a false sense of security. So many variations depending on fabric used. I've been seeing that a lot.
That's been it's actually been kind of heartwarming, almost a World War II type thing where everyone's rallying and, everyone's pulling out their sewing machines. The data, so it's complicated, but I think the best place, I think if everyone had one of those, the best use for those would be if you got sick or someone in your family got sick, and you would have the person who was sick wear it. So we're pretty sure that anything made with a cotton, a tea towel or other piece of fabric will keep the droplets in and prevent it from spreading and protect other people. Most of us are not comfortable with homemade masks for healthcare workers. I don't think that's really appropriate. I mean, it's a kind of worst case scenario, but putting them on family members or yourself in the home, I think it's very wise to have those. And since masks are so hard to come by, definitely good to have a few of those handy.
Yeah. Question from Sam: what can we do right now to help with people's mental health needs? And so I think we can, we'll go start with the doctor, and then maybe Heidi, if you have any programs that you see from the federal government or anything.
Yeah, I mean, it's definitely something we're very aware of. Even in hospitals, we know that the stress of this situation is putting a lot of healthcare workers under a lot of stress. And I know most of the hospitals I'm aware of have various ways to kind of connect healthcare workers to mental health experts. I know other hospitals are doing a lot of televisits, things like this. But yeah, we definitely need to make sure people have access to the mental health professionals to get through this difficult time. It's stressful for every single person to varying degrees.
I think that everybody deals with stress differently, but we have people who already have a lowered resiliency, and we have seen dramatic increases in the rate of suicide in our country. And so being isolated, we know that physical connection, that human connection is so important for mental and behavioral health. So I can tell you what I've been doing, for 10 days now, 11 days now to feel less isolated. I love music. And so what I go out on YouTube, Trisha Yearwood and her husband, the name escapes me. I mean, I love him. Garth Brooks just did a YouTube video. They did a Facebook Live concert. Neil Diamond just did a concert. I don't know if you saw it, where it says "hands, not touching hands." Out, I won't touch you. You don't touch me. And so along with the humor, I think get on your computer, go out on YouTube, and don't look for the happy. Look for people doing wonderful things for each other. There's so much out there that shows just the kindness, and we've gone from cat videos to cute kid videos now, and so I think when you realize that the human spirit is alive and well in this country, and we're seeing maybe in some ways the worst, but that is overcome by the best of people checking in on their neighbors. And I would say, if you have a neighbor who is a senior who is afraid right now, check in on them. You don't need to touch them. You don't need to do anything other than knock on their door, back up, and they can open up, stand 6 feet apart, and have a conversation with them. And so I'd say, the best way for you to stay mentally healthy is for you to give to your community. I think it's always a great strategy. But if you are in that spot where you already have a behavior or mental health problem, reach out to the behavior and mental health professionals. Get help.
Yeah. Can I add something there too? That kind of related to that, definitely check in on neighbors. And then it's also good to get outside. Most of the country's really warming up. Hopefully North Dakota is not far behind us. We're really kind of beautiful weather here in Iowa is broke. Spring is sprung. And one of the safest places to be outside. Air exchange is pretty much infinite outside. And so it's hard for the virus to last. So if you stay 6 feet apart, go for a hike, go for a walk, definitely don't touch playground equipment or whatever, but everywhere else it's good to get outside. And that's good for your mental health too, to keep physical activity. You don't want to just sit in a chair for the next few weeks.
Those are great suggestions. Heidi, I have a question for you, actually. One thing people have been asking me, and I think it'd be good from somebody who's been there, everything or the bill got passed last night. How would something like, I know the CCC got about, what was it, 9 point something billion. How would that get in there in the first place, and kind of what are kind of the behind the scenes on how that bill was constructed?
Well, I think there had been a lot of work already done, and as much as I think it was improved by a couple-day delay, the bones of this bill were pretty much the same as what you saw on Sunday. Really rapid agreement on we need more dollars for CDC. We need more dollars for the National Institute of Health. We need to make sure that our military is protected. We need more dollars for our military and to get people home from the Peace Corps. I mean, so there's a number of these pieces that I think in some ways get criticized, but they have great responsibility behind them. The food security piece, that was a big fight between, were we going to amp up food stamps so that people could have those resources available? And if I can just take a moment, I think it's interesting because there was a movement towards cutting food stamps, and now we realize that's kind of foolish. And we know how important the SNAP benefits are to our rural grocery stores, for goodness sakes, never mind our rural hospitals. And then there's a huge component in there to amp up money for public health. And we can kind of categorize that, but to help hospitals and to help our first responders to get equipment, to pay for equipment, to make sure that people are tested and that the tests go out as the doctor has said. So that all of that is the stuff that you typically think about government infrastructure. The stuff that's not government infrastructure is, what do we do for the large businesses? We need to make sure that those businesses stay at least solvent so that we have a transportation system. There's a lot of money in there for Amtrak. You might say, why would you do that? Because you need a train system when this is all over. You need a transportation system when this is all over. And so, is the balance right? I mean, when you're doing a $2 trillion bill in a week and a half, it's not going to be perfect, and there's going to be a lot of complaining about this or that. I think that the real concern that I have is not what's in this bill, but given the depleted state of our federal workforce. And I used to run the committee. I was ranking on the committee that dealt with the federal workforce. I'm concerned that there aren't enough professionals to deploy this money as quickly as what we need to deploy it to provide that economic safety net, so that we have an economy that doesn't go into a depression, and that people can come back, and that this is an incident-related recession and not a structural recession in the end.
Yeah, I saw that over 3 million people filed for unemployment this past week, which is a huge amount, and it's probably only going to get bigger. Do you think there's going to be additional bills to kind of fill into the gaps that were missed, or I mean, this is I've heard some folks say like this bill is kind of intended for the next few months, and then what happens then?
I think it's going to depend on whether we end up, as a result of this, going into a structural depression. What do I mean by that? I mean, what we're seeing right now is this recession, which I think we're already in, has been driven by a healthcare crisis. And so the thinking is that once the healthcare crisis dissipates, and that's why taking the advice of the doctor is also great medicine for the economy. Opening up too soon is bad medicine for the economy. So let's hunker down. Let's get the nation physically well while we're working on keeping our economy viable. If in fact this is pervasive and it puts us in a structural economic crisis, then we're in for a longer haul. And I think that's when you can expect a lot of people coming in saying, we need a huge stimulus bill, like was argued in 2009 after the financial crisis, to basically get money into the economy. I think you're going to see it going into infrastructure. You're going to see it going into a number of things. And I want to point out something that I forgot, JD. There is money in this supplemental appropriation bill that Congress hopefully will pass once the House makes up their mind on what they're going to do with it, for rural broadband. Because the one thing we know, as we've been talking about mental health and talking about the need to expand services in rural areas, that telehealth and that telemedicine can be so critical. But so we'll see if there's a fourth wave, a fourth tranche. I think there isn't consensus that there needs to be at this point.
Right. And we just did a video that I think we released it either yesterday or this morning that talked about rural broadband, and we have over 20 million Americans that don't have access to a broadband connection right now. And so we talked about short-term and long-term things. So folks, if you want to look at that video, I'm sure it's on our page as well. The next question, I think for the doctor, what are the best practices for healthcare workers that live with family?
Yeah, that's a difficult situation. It depends on your level of risk in your job. If you're a frontline healthcare worker, I've seen some emergency physicians kind of sleep in separate rooms and use separate bathrooms because they're afraid of spreading it to their family members. I will say, if we get our PPE, so if we get our gowns and gloves and masks and respirators to an adequate supply in healthcare, there's very little risk for healthcare workers. It sounds surprising, but where we're seeing healthcare workers become infected is not in the hospital, it's actually in the community. So where there's widespread community COVID-19, they're actually catching it outside the hospital. The PPE really does work, but the problem is a lot of places, especially New York City right now, they don't have access to it. But generally, I think it's also just keeping awareness. Take your temperature. If you start feeling sick, then isolate yourself, put on a mask. And fortunately, I think I should say most people would be worried about their kids, and it appears most children are not drastically infected. They do get illness, they do get fever, but this is not a severe disease, thankfully, for our young kids, unlike pandemic flus in the past that really hit our young kids. So there's little risk giving it to kids, but of course, for your partners, husbands and wives, it can be a different story.
And how quickly can a vaccine be made and given to the public, and is it too late to even have one? Next question.
Yeah, so it's definitely not too late. They've already developed several candidates. I think several are already under trial in the United States and in China and probably elsewhere. But those are safety trials. And so what I'm hearing is it's 12 to 18 months before we can develop a vaccine. And as Senator Heitkamp said, that this isn't going to be the last one of these that happens. So we definitely need to work on a vaccine. This virus may come back in the fall next year, maybe a different virus. So anything we can learn about the safety of coronavirus vaccines or other vaccines will help us in the long run. We can't do this again. I mean, if we don't wake up from this, I don't know what's going to wake us up. We focus a lot in this country on individual health, and we have a lot to learn there too. We're way behind a lot of countries in individual health. With universal health care, which we don't have here. But we are also really lagging in public health. And I think what we're realizing is you can't have individual health and a good economy without strong public health. We need it just as much as defense spending, equally important.
Yeah, and if I can point out that the work that was done back in the 90s by the public health community in tobacco cessation and prevention, that's been a godsend. People who are smoking are at much higher risk for very adverse consequences when you have a respiratory illness. And so, public health strategies work in this country if we're willing to invest in them.
Right. My mother was a public health director, and I've heard this for years. So if my mom's watching, thanks for watching, Mom. I'm listening to you. We have one final question, and it's from Jill. Are there any models out there that will show how many people will be infected in Iowa?
Yeah, that's an excellent question. I have not seen one specific to Iowa made by the Iowa Department of Public Health, but there are several online. If you can find me on Twitter, and I can send you the link. I don't have it off the top of my head, but there are, for every state, they have when we expect the peak to be, if we do social distancing, how that will impact if we do shelter in place. So there are a lot of amazing models. I would like to see the state of Iowa release one so we can project as well. That would be wonderful.
Yeah. And remind me, what's your Twitter handle so people can know? I think we'll put it below.
Yeah, so it's ELIOWA. So L Iowa, Eli, Iowa.
There we go.
Yeah.
Well, I can't thank both of you enough for hopping on, helping us get more informed in these uncertain times. It's so many people have questions, and for folks who are watching us, we will continue to do a bunch of series of different things to try and be more active in these uncertain times, try to answer as many questions as possible, and we're all in this together. And a couple things I want to let folks know about. We'll put this in the comments section for folks to know. If you want to stay informed, the state has a hotline at 211 for any questions. If you or your loved ones exhibit any symptoms, please contact your local physician or state health department at 1-800-362-2736. The Iowa Department of Public Health is at idph.iowa.gov. The Center of Disease Control is cdc.gov. We're going to be releasing a lot more information. There's all types of hotlines. We'll be letting folks know: suicide prevention hotline, sexual assault hotline, and domestic violence hotline. As we all know, just because the COVID is here, it doesn't stop everything else as well. And so I know there's a lot of great things that are being done in our communities right now. School meals in Storm Lake, Des Moines, Fort Dodge, and Carroll are being handed out. And for those, check your local school districts. And again, I want to thank the doctor and Heidi for joining us. And thank you all for watching. We'll continue to do these series. Have a safe night. And just remember, we're all in this together. So thank you.
Thanks, JD.
Thanks, JD.